Opposites affecting your health certainly do include your skin, so Dr. Orden's backstage in our Opposites Beauty Lab.
That's right, Dr. Travis. We're back at it, and to help me, my dear friend, board-certified dermatologist, Dr. Ava Shamban is with us to show a new technique. But first of all, I'd like to introduce our client.
Called the eMatrix. It's a radio frequency device, not a laser. And the way it works is by delivering energy as heat, and I'm demonstrating here by marching right along the neck, so that we're heating the deeper layers of the skin where the collagen and the elastin are made to stimulate new formation and to tighten the neck over a period of time. And you can see these little bands right here. We're going to treat these a few times. And here you can see how the heat goes deeper into the skin and it protects the top layer of the skin, the epidermis, where the pigment cells are, so you don't see any change in the color, which is a huge advantage. Look, yes, and you want to have a seat here next?
A little later.
A little later. All right, so I'm going to continue. We're also going to treat these necklace lines. You can see that Gina has a few of these necklace lines, and we really want to get those gone too, so that she has the ultimate sexy, not saggy, but tight neck.
All right, I'd like to show some pictures to give Gina a little bit of an idea of what she can expect after this type of treatment. So you can see the before and afters. I mean, that's a pretty nice...
That's a pretty nice non-surgical result, I think.
Right, that is a pretty nice result. So you're going to keep doing your work, and I'm going to be back for mine in 1 second.
Hello again. So this is one of our patients. Her name is Michaela. She's in her mid-30s. Michaela grew up in California. She's been in the sun a lot. She has a substantial amount of sun damage that she would like to undo. She also has some acne scarring and some pigmentation. She wants her pores to look a little better, and she wants some improvement in her brightness. I've discussed different modalities of treatment with her, including chemical peels, including resurfacing using the Fraxel non-ablative and ablative technologies. And we have come up with the idea that the eMatrix sublative rejuvenation would be the best for her. Michaela has been numbed for about 30 minutes with a topical numbing cream. This has been now wiped off her skin, and we will be using the eMatrix using the 64 pulse handpiece. And this should be a very simple treatment for her. As you can see, Michaela is skin type 2. She's a white skin type 2, and this machine will work for her very well. We use this machine a lot for people who are darker skin, like the type 3, 4, or 5, or even 6. Because the radio frequency spares the epidermis, therefore the chances of getting post-inflammatory hyperpigmentation and essentially any kind of pigmentation is very small. So for darker skin patients with acne scarring, or just to improve their texture, tone, color, pigmentation, just to give them a brighter skin, for darker skin, this is a very safe machine to use. So Michaela, we're going to just start this. You may or may not feel these. As you can see, this procedure is extremely simple to perform. These pulses are put side by side. There is about 10% overlap. We will treat the entire skin of her face. The good thing about this machine is we can also use it off face, so we can treat sun damage and laxity on neck. We can also treat the back of the hands, the chest, the arms, as well as the back. This procedure on Michaela will be repeated in about 4 weeks, and we'll do about 3 to 5 sessions for her. There is not much aftercare with this. She will experience some redness. As you can see, she already has a little bit of redness. This redness will probably be a little worse towards the day today. and then within the next couple of days, the redness will subside. So as far as the what happens from here on, she will have some redness for about a day or two, as we discussed, and then after that, she may have some swelling. She may see some maybe pinpoint pigmentation, some crust maybe here and there, but essentially most of these will be gone in 3 to 5 days, and we will ask her to use moisturizers of her choice. No alpha hydroxyretinol or any of those things that she generally uses, and of course sunblock when she goes out in the sun. We'll be seeing her every day. We'll take pictures to see how she looks like for the next 7 days, and then we'll repeat the treatment in 30 days. Thank you.
You're watching Local 10, home of Local10.com. WPLG Local 10 News at 11 starts now.
Acne is the most common skin disorder in the U.S. It affects an estimated 17 million teenagers. But even after the breakouts are over, many are left with the evidence of acne, deep-pitted scarring. Well, tonight, Local 10's Christy Kruger shows us how a laser treatment is helping ease the appearance of those acne scars.
What's the matter?
I happen to have a blemish.
Real-life problems can seem funny on the big screen.
Oh, God, of all nights, a corny column's record hot. I've got craters.
But for millions of Americans, breakouts are not a source of laughter.
Problem is, some people are caught too late, or some people just have bad flare-ups, and some people are left with horrible scars.
You would have breakouts, and sometimes you play with it and you try and make it better, and you create a worse situation. So now I'm trying to fix that.
28-year-old Shannon Spagna is hoping to erase the scars of the past with a device called the eMatrix.
So if you really look at this carefully, you'll see these little holes in this particular handpiece. So this is a radio frequency device that causes energy to go between these little holes and creates these little columns of energy into the skin.
A numbing cream is applied for 5 minutes before the treatment, which takes another 30 minutes.
Sometimes these devices such as this that give you a day or two of redness are better in certain aspects in treating certain things than these big recovery things that take you weeks to heal.
Maybe you feel a little bit of heat from the laser, but nothing you can't handle.
While the treatment can't erase the scars completely, Shannon was happy to see the scars diminishing and her confidence growing. The eMatrix technology relies on the body's own wound healing response to create this new collagen, which helps fill in those acne scars. Because collagen production lessens as we age, the treatment will have better results on younger patients. With your health news, I'm Christy Kruger, Local 10 News.
Today we're demonstrating the eMatrix radio frequency device. This treatment provides skin resurfacing as well as skin rejuvenation to help your skin look and feel younger. This treatment will improve acne scarring, will minimise your pores and will soften lines and wrinkles. It will also rebuild your skin's collagen that has been lost over time in your face. At last, we have a treatment here at MBNS that can tighten skin around the eyes and reduce saggy skin. The Matrix Lift is suitable for all patients' skin types, from the lightest skins to the darkest skins. And guess what? There's no fear of discoloration within the skin. This is the MBNS Clinic's eMatrix machine. We understand that we're one of the first in the United Kingdom to operate this machine. The eMatrix Lift is also unique because it penetrates the skin, leaving a sequence of microscopic dots which spares the skin from extensive damage while stimulating the growth of the skin by promoting new collagen and so improving texture and appearance.
And on the screen you get a nice illustration of how the energy is going to be delivered. So for example, if I turn up the energy, you will see that the illustration is showing us that we're going to have more ablative energy in the white zone, a more coagulative energy in the red zone, and then thermal energy in the green zones. So it's nice to see what you're going to achieve. For example, if I turn the energy down and go to a lower setting, you'll see that the energy is not going to be ablative, it's purely going to be coagulative and then heating thermally.
This is Anne, and she's going to have her second eMatrix treatment today. Anne, tell us why you wanted to have this treatment.
Well, as I age, I'm now 47, I was thinking that my skin was beginning to lose its elasticity and I wanted to be able to give it some new life. Well, specifically the areas that I wanted to have treated were under my eyes and also the large pores that I have on my nose and around my mouth corners, which I found the skin was beginning to sag a little around there. I first had my initial treatment 8 weeks ago and I've already seen a great improvement, but following the nurse's advice at MBNS, they decided that I should have a second treatment to see optimal results.
Okay, so here we are with the MBNS Clinic's eMatrix machine, and we're just going to perform Anne's second treatment. You can see that I've put the settings in, and it's really very simple. I'm just going to put the tip, which is the radio frequency tip, just very lightly on Anne's skin, which is numbed, isn't it, Anne?
Yes, it is. Yeah, I've had an anaesthetic cream on for about an hour.
That's what we would advise. So I'm just going to float the treatment head and then press the button. You might hear a click. Anne, are you ready?
Yes, I'm fine.
Okay. 1, 2, 3. Did you feel that?
Very slightly.
How did it feel?
A tiny bit of warmth.
Okay. It's quite a gentle treatment. How's it feel, Anne?
It's actually fine. It's nothing that you could say hurts. It's just a warmth that's applied to the face. Well, it's now the next morning. I had my treatment about 18 hours ago, and as you can see, I'm quite inflamed, red, a little tender and patchy. You can see where the laser has passed over my face in these areas, and especially taking note of my eye areas where I wanted to have the treatment done quite specifically due to the wrinkles under my eyes. So as you can see, it definitely is working. Well, here I am, 18 hours after my second eMatrix treatment. My face has responded well to the laser. I can see that it's quite red, it's a little patchy, it's a little tender. Nothing too dramatic. It's not painful by any stretch. In fact, I would say that it looks worse than it feels. The laser has passed over all of my face and I think that it's done a good job. So now I'm ready for my day. I have put on my serums, ProHeal first, then HydroCool, and then I followed with Leica Gel and then Bare Minerals makeup, and I'm ready to start my day. The areas have been covered well, I think. I don't think anyone would notice that I've had any laser treatment, to be honest. Underneath the skin I feel a bit warm, but nothing at all that would inhibit me from going about my day.